Hi, this is Fix My Fibro and my name's Bernadette. Thanks for listening. So if you notice, I change my clothes or try look different in each video and change the surroundings. So because there are going to be so many videos, I want you to sort of you sometimes forget what you've watched. And so when you're going through the list, you go, oh no, that's right, I have seen that one because I remember what she was wearing. So you should see the pile of mess of clothes I have on the side of the floor. Because I've been doing lots of videos lately. Anyway, today I want to explain the concept of mast cells in your body, but I want to talk about them as if we're talking about a city or something like that. Like I'm going to give you an analogy to how to explain them, and then explain why it doesn't show up in any blood tests because of that. Because of the nature of it. So you have to have watched some of the other videos and understood what mast cell activation syndrome is. So a mast cell that I talk about in other videos is an immune cell, and I'm going to call it a party popper. So we all know what a party popper is. I didn't go buy any because they're wasteful plastic in the environment that we don't need. It's like a little plastic capsule. It's got a string on it. You pull it. It's got a paper ending. It opens up and all these streamers, confetti, crap comes out. That's a party popper. So a mast cell is a party popper, all right? Think about it like that. And your house that you live in is one cell in your body. And then the cell next to that cell is your neighbour's house. And then the next neighbour and the next neighbour, and suddenly you have a city or a suburb and then a city, and they're all the cells in your body. And, one city up the road might be your kidneys, another city might be your heart, might be your liver. You're going to have all these different houses, all these different cells, and all these party poppers. So mast cells or party poppers live or are located in the street. So the streets are your blood vessels, all right? So you got that? Houses are your cells, blood vessels, or streets are your blood vessels. And then the blood vessels, as you know, when you cut through a piece of steak, you see a cut blood vessel. It's got a lining in it, like it's got the slippery side. That's called an lumen or your mucosa, like the lining. You have an elastic lumen in the middle, which is what makes your arteries pump. And then you have a lumen. So if that was your road, the gutters are your lumen or your edging, are the edging to your arteries. So all the gutters in front of your house are your blood vessel wall linings. The gutters are your wall linings. Mast cells are located in those gutters. So they're not actually in the bloodstream, but they're in the outer wall of the artery, not on the inside, because that's why we don't pick them up in what they're evacuating into blood tests. When a party popper pops, when a mast cell degranulates, it pops into your house, messes up your front lawn, goes into your house. Suddenly you're having a party of pain, inflammation, fatigue, you name it. Your mast cells popped. But the thing is, when a party popper pops, it doesn't just pop into your house. It pops into all the houses in your street. Suddenly you're having a street party. And so you're having a flare. That's it. Those mast cells popping in a localized area. So you might go, oh, I've got a pain right here. Oh, I've got an itch right there. Oh, I've got a headache right there. I'm wheezing. Your mast cells, your party poppers in your lungs, because mast cells are located in that lining of your lungs, the lining of your gut, the lining of your arteries, the lining underneath your skin. You got lining, and you got party poppers everywhere. And when you start popping, the party goes crazy. So when one street starts having a party, little mini flare, it then activates, because the way the party poppers, the contents of your party popper, all your cytokines, your inflammatory markers, your histamines, there's 1,000 contents, bits of confetti, all those, they're all biochemical mediators in your body that cause symptoms, cause inflammation, cause vascular dilation, cause leaky gut, cause everything. Those 1,000 things, it's not just histamine that gets released. Histamine is a big part of it, and we have to talk about that because of your enzyme levels in another video. But when you party pop and you're having a street party, but it's not happening in your blood vessels, not happening in the blood coursing, which was what they pop your needle in to take a sample of to try and measure for cytokines and things. It's happening in the tissues. So guess what? There is a diagnostic test that measures and shows that party popping, that mast cell degranulation, it's called. And it's called degranulation because the party popping effect of all that stuff spewing out into your front lawn and into your house, into your cells, and into the whole street, the cells of all your street, or all of the, in that aspect, it's in your tissues. So unless you do an invasive, stick a needle in, take out some cells, get an excavator in, take out some houses, have a look at them underneath a microscope. Unless you are looking at those cells, you actually take a physical biopsy and then do a staining technique. And a staining technique in a laboratory is like spilling beetroot on your white shirt or spaghetti sauce when you're eating. That's staining. Like, you all know stains. We use that as a scientific test. It's called histology. There's a lot of staining of cells. And so there is a histological test for mast cell degranulation, but it requires a physical tissue sample taken where those mast cells are degranulating. So unless you can get a doctor to stick a needle in you to take out some cells right next to your artery, right next to your lungs, right in your gut, having a colonoscopy is a good way to get the gut one done. But no doctors do that. It's not a routine test. It's a basic, simple test. It's one of the cheapest tests in diagnostic pathology, but no one does it because it's invasive. We live in a world of non-invasive blood-based diagnostics where you take a blood sample and our blood tells us everything. Well, I'm sorry, the party popper domino effect, because once one street's having a party, the next street has a party, because those cytokines, the inflammatory markers that it's spilling out, they communicate on a cellular level, cell to cell to cell, so they'll activate all the cells. So like when you have a really bad toothache, separately of MCAS, just a general toothache, it's not just your tooth that hurts, and suddenly it's your whole face and your jaw and your head, because the cytokines are activating all of your cells, and you're having this party popper issue happen in MCAS, and it then has a domino effect if you're not being treated, if you're not managing your symptoms by supplements, and you're not altering your diet to minimize excess histamines, which in their own right cause brain fog, fatigue, wheezing, coughing, sneezing, headaches, gut issues, like the list goes on. Look them up online if you don't believe me. It verifies everything about what these molecules are doing. So I hope my party popper and domino effect explains what's going on in your body, where it's going on in your body, and why you're not diagnosed.